So I'm going to really quickly cover the agenda. So what we've got is a really packed agenda. We've got a number of people who are going to talk for just a few minutes. First of all, my name's Angela Gill. I know most of you that are here today, I hope. I'm the facilitator for today, and I'm ably supported by Daniel, who's GVA's sort of community engagement officer, but also he's the technical and design whiz. So between us, we're managing today's event. Just to have a quick look, I'm not going to go through everything in detail, but we've got Elizabeth Kerwood starting off shortly on how did the Surgery Signposter project begin. Then she'll be handing over to Nikki Staveley, who's going to give a personal reflection on the project, really, as a chief officer. Then after Nikki, we've got Caroline Dinage, Gosport's MP, who's going to look at what impact Surgery Signposters has made and how has it helped people in her constituency. From Caroline, we're going to go over to Jeanette, who is one of the original Surgery Signposter volunteers who started with the project, and she was telling me this week she's actually got some of the original letters and paperwork from 5 years ago. So well done, Jeanette. We've then got Zoe Huggins, who's our mayor, who's going to look at the value of surgery signposting, but as a volunteer delivered project. And that for me is one of the unique selling points of this project. It is coordinated by Angela Gold, managed by myself, but it's actually delivered by a team of amazing volunteers. And that will link us really nicely into a short video. So at that point, I will come out of the PowerPoint presentation, and my colleague Daniel will play a very sort of short, it's about 4-minute volunteer perspective and a service user perspective around surgery signposting. Then I'll come back into the PowerPoint, and we have Angela Gold, who's the surgery signposter coordinator, just talking about the project learning and the service improvement. So when we joined the project, for me, 2.5 years ago, what we tried to do is look at the great work that had already been achieved, but we then wanted to move it forward. And Angela's going to talk a little bit about the improvements we brought in. What I'm not going to do is spend too much time on the community compass aspect, because today is a celebration about surgery signposting, but it would be wrong of me not to mention something that is going to sustain the people in Gosport during the pandemic for the next sort of 3.5 months or so. So I will mention Community Compass because that's really good. And after all of that program, you're all then free to go. So without further ado, I'm actually going to hand over to Elizabeth Kerwood.
Good morning, everyone. Thank you, Angela, and thank you for the time this morning to be able to reflect and celebrate surgery signposters. I am one of the communications and engagement leads in Farewell Gosport Clinical Commissioning Group, and I've been involved with the voluntary sector for a number of years through my work. So I was asked by Angela, how did it begin? And so I kind of went back in my memories, and it began, and I'm looking to Nikki to see if there'll be nods. There was an idea, and there was just this moment of this idea, talking amongst myself and voluntary sector colleagues, Nikki and others, going, there's something we can do here, and we can't quite quantify it and we can't quite describe it, but we want to try and build a bridge between the voluntary sector and all the amazing support that the voluntary sector can provide and patients, people. How do we make those connections? And there's something about how can we do that through primary care, and what does that look like, and how do we do that? I think what it came from is a number of different conversations. The voluntary sector saying, we're here, we're happy to help, there's loads we can do, how can we get individuals? And our GP saying, we know the voluntary sector are there, we know they're great, but we don't really know them, and we don't know how to connect to them, and we don't really know, and there's lots of them, and it's really hard to work through that in a very short consultation with a patient. So surgery signposters was born out of people going, let's have a go at doing something. So we were then able to access some funding through the Wessex Academic Health Science Network, and part of their role is to provide funding opportunities for those ideas that you just kind of think, we need to have a look and let's see what that does. So between us, the CCG and GVA successfully applied for that funding in 2015. I will never forget that experience. I went up with the chair of GVA. It was a little bit nerve-wracking. It felt like an interview, but we got it. We got the funding, which was great. So we started it off, and it was meant to be a 2-year project. That was what it was meant to be. And actually, we ran it for 5. So that's testament in itself. It's been supported through a range of different funding arrangements. So we've had the Gosport Borough Council have been involved, the CCG, Hampshire County Council, and initially we had 3 pilot sites, one in Gosport, one in Havant, and one in Fareham. Fareham have been interesting in their own right, and haven't worked quite in the same way as Gosport. But what we do know is that Gosport Service did make and has made a significant contribution to those in its community. So thank you to all of the signposters who've been involved. And whilst today is a farewell event, actually it's the start of something else for us as well. So all of the learning out of surgery signposters, and it's been a bumpy ride because it is when you learn and what did that work and did this work and how can we change it. What it has done is it's really helped to shape local approaches and thinking about social prescribing and how can you think about people holistically and look at all of the different factors that impact on their health and their well-being. And we are doing some work now around what we consider our high intensity users. So we want to take the learning from social prescribing through surgery signposters and really target it in on those individuals that we know who use NHS care services a lot. And actually, if we did something different and provided some different support with them, they'd get a better outcome. The NHS isn't always the answer. So I'd like to thank everyone who's been a part of our journey and to do that together. When I sat in that interview 5 odd years ago, I didn't quite know where it would take us. So I'm very proud of everything we've been involved in. So yeah, thank you.
Great. Thank you very much indeed, Elizabeth. So I'd now like to hand over to Nikki Staveley, please.
Well, I'd just like to say a huge thank you to Elizabeth, actually, and to acknowledge all the work that she put into surgery signposters all the way through. She's had our backs, and I absolutely couldn't have done it without her, or indeed Donna Simpson from Gosport Borough Council, who was very closely involved at the beginning, and Dr. David Chilvers. Well, we were the forerunners for social prescribing, and I feel very proud of that. As Elizabeth says, I think there was nothing on the NHS agenda, or very little, something in Rotherham, a project in Rotherham when we started. And so we were breaking new ground. And what I feel very excited about, and when you look at the numbers and the number of people we've helped during this project, I think you can see what we've achieved. And I think also, and I think Elizabeth will agree with me, this came out of the vanguard, the NHS vanguard, the fact that for the first time in the 20 odd years that I have worked in Gosport, there was a real feeling that the voluntary sector were equal partners and equal players in this, and that we needed to be involved in developing a better care system. There was a huge shortage of GPs at that time. The whole primary care sort of environment was changing very quickly, and we needed to be able to help. One young GP came to me one day and said, "How can you help me? I'm not a social worker. I want to help with medicine. I don't want to help with social support. I haven't got the time." And that's when it really became clear that we needed to develop this project. We also proved, I think, that the voluntary sector can be very professional. And I'm sure that Elizabeth would acknowledge the fact that we have done a good job. We have met every single outcome that was asked of us. And if it proved that there was a need for social prescribing, then that is our work done. And I'm very delighted to hear that not only the Willow PC network, but is it the West PC network is also taking on link workers. And so again, I think there will be more provision in Gosport. As you can see, patient demand, particularly around mental health, has been huge all the way through. The fact that we could spend 40 minutes helping, listening and really understanding the issues behind the supposed medical problems, it has been enormous help. And particularly during Corona, we've used our incredibly experienced team of volunteers, and all of you there in the frame now are people with over 150 years of experience of social care, health work, and mental health experience. So we couldn't, if we tried to employ all of you, we couldn't possibly have afforded it. But how lucky are our patients to have you there to support them. And they have been particularly useful for the very complex cases that we have come across during the pandemic. So what's our legacy? Well, our legacy is a very rigorous and professional training course, which was developed including the Making Every Contact Count course, Public Health England course. We still have that, we can still roll it out. It provided the bedrock for the Care Navigator training for receptionists in primary care right across South East Hampshire. And we now have a trademark for surgery signposters, I'm pleased to say. So should the NHS in time and in their wisdom realise that actually it's not a bad idea to have a volunteer delivered project, because after all, volunteers are always the bridge to the community, we can actually reclaim that and start again. And I think that may need to happen, but I'm very, very delighted in the meantime that social prescribers are there. So we are leaving you, and we're leaving Angela Gill. And Angela Gill ran the very first Hampshire Social Prescribing Forum, which we started. We created the model in GVA. It's now, I don't know, I think you had 70 odd people on the last Zoom meeting. And Angela Gill is a guru. She's the go-to person who knows about social prescribing and the voluntary sector. So don't lose her. And thank you to everyone who's been involved. I've been exceedingly proud of this project and will continue to watch and see how it develops in the future. Thank you.
Great, thank you very much. We worked really closely with the Willow Group, and one of the regular referrers is a colleague that I met through the Better Local Care when I was learning all about different terms like MSK and frailty pathways. It was a massive learning curve when I went to the joint meetings that we started with. And Adrian Frederico was at those meetings, and this is one of the quotes which he sent through, I think last year, about his view as a pharmacist of the Surgery Signposter project. So I put that in just to share that with people, really. Thank you very much, Nikki. I'd now like to hand over to Caroline Darnage, please.
Oh, that requires me to unmute myself, doesn't it? Thank you so much. It's lovely. It's so lovely to be here to celebrate the incredible achievements of the surgery signposters and their just groundbreaking work on social prescribing, which is literally one of my favorite things, or it has become one of my favorite things since you guys introduced me to it all those years ago. I don't think at the outset I really understood the potential it had, and as Nikki said, it was one of the vanguard projects, and they were projects that were funded by the Department of Health up and down the country to sort of trial or promote some really interesting and innovative ideas at how we could improve health and well-being outcomes, and that, you know, there were some really interesting things that were trialed, some of which have really come to fruition, like, you know, Skype GP consultations, which were trialed in Warwickshire in the care homes community, and at the time the trial all went very well, but it wasn't really until this year with coronavirus that we actually saw it come into its own. So the vanguards were really quite remarkable, and this was social prescribing was one of them. But I don't think anybody had, apart from the good people of Gosport, had anticipated the huge value that it could have to just people's lives and well-being. And it was Nikki and Angela and the other Angela that kind of sold this to us and proved the concept, really. And then I went on to become the Minister of State for Care, and I was responsible for social prescribing, and I just saw firsthand the lives that it had changed. I met a remarkable lady by the name of Debbie. Any of you that are on Twitter, you can follow her. She's got a Twitter handle called the Debs Effect. And Debbie had struggled with some physical and mental health issues for most of her adult life. She was pretty much bedbound, but she was certainly housebound. She was told by the NHS trust, her local NHS trust, not ours, that she would never work again. Her children. And then at a doctor's, she saw a leaflet that recommended an art course, and it was a few £100s. She took this art course and she's never looked back. She has now sold over 200 of her paintings worldwide, and she works as an art therapist for the very NHS trust that told her she would never work again. And I think that's just such a remarkable story, and just shows the strength. You know, for me, she epitomized. I used to drag her in all the time to speak at events when I was trying to persuade people in government of the power of social prescribing. And I've got dozens of other stories just like that, which just prove the value of it more than anything. And yet there we were in Gosport, my hometown, that really identified this almost before anybody else. And so when I was Minister for Care, I announced £4.5 million for social prescribing schemes to try and spread it right throughout the country and get much more value, because we've seen that these schemes have shown an 80% reduction in demand on NHS services. And in Gosport, we really have seen firsthand how social prescribing can really help those who need it. And it just makes so much sense. And I don't know why the country hasn't put two and two together before now. I remember going to visit the men's shed. Our men's shed are very close to my heart. I was at their very first meeting where there were just 9 of them. Now there are hundreds of them. And at the very first meeting, I said it was like having a room full of grandfathers. Now it's, over the years, it's been like having a room full of dads. And I'm very close to the age now where it will be potential future husbands. So they are remarkable. And I remember meeting one gentleman who had come back from working overseas and had found the men's shed via a social prescriber in the Gosport area in his local GP surgery. And he said to me, he was so lonely when he'd come back from working overseas. He left all his friends behind. He had no family here in the UK. And he said that this scheme, the men's shed, had literally saved his life. Because we know that loneliness costs the NHS more than smoking. We know that loneliness costs lives and leads to so many other health issues. But GBA signposters have helped hundreds of people with loneliness, social isolation, with mental health, but also with things like benefits and advocacy, and referred them on to not only the amazing charities and local groups that I talked about, like the Men's Shed, but also other organisations like Citizens Advice and the Gosport University of the Third Age and the Leisure Centre and others that do such great work in our area. So really, from me, I'm going to shut up because you know how politicians love to go on, but I just wanted to make a very special thank you from me to everybody who has made this project possible, to the wonderful Nikki Staveley, and Angela Gold, and very specifically to the remarkable Angela Gill, who is a force of nature and has pushed this through with the most incredible energy. I've seen her on a tennis court once or twice, and she hits the ball with the same energy that she approaches life. It's terrifying when you're on the other end of it, but my God, does it make a difference to our local community. And above all, thank you to all the remarkable volunteers that have made this something so very special. And I wish you all a wonderful Christmas.
Thank you very much, Caroline, and thank you for the kind comments. That leads really nicely into our next speaker, who is one of the volunteers from the original 5 years ago when it all started. So, Jeanette, I'm handing over to you, please.
Thank you. Morning, everyone. Right, as I say, I had all my paperwork still in a little folder from when I was signed up. So I signed my paperwork back in June 2015. Audrey Starkey, Chris Fernley, Cindy Tull, Ina Nash, Mo Pratt and Sheila, we were the first 6 that went into the surgeries. We were all a bit apprehensive, I think, not knowing what sort of questions we were going to be dealt with on the day. But lots of training, presentations from lots of groups. And I think it was November when we actually kicked off. And it was really quite quiet when we first started, waiting for everybody to hear about us. So everybody would sit through all the leaflets. We had a big box full of leaflets, so occupy our time. We would look through the leaflets to see what else was out there. I'm an administrator trained, and I typed them all up into a PowerPoint for everybody. So it made it a bit easier for everybody to find what they were looking for, rather than looking through all the leaflets to find the individual one. And of course, we've had lots of changes over the years, lots of different people, and lots of different forms. So a lot of get way around that way. We also started with just the 20 minutes, which was double the GP appointment. But by the few months later, everybody said that just wasn't enough time. So that increased to 50 minutes. That included our write-up time, but just shows you the length of time that we needed to let people speak for. I mean, at times I didn't get home until an hour after I was due home, which not always good, but I had nobody waiting for me besides the dog, and she's always been really good. The main issues I think I remember back then were, as you say, bereavement, poor mental health, and how it was benefits and tribunals, especially for people with mental health problems. The Citizens Advice Bureau was always a quite scary place to go to. So having a local voluntary group to go to was a lot easier for most people. But this year has been particularly hard. Even talking to, I was part of the befriending group that was with Gosport Borough Council, and then it's been isolation, but a lot of housing problems this year, with financial troubles and employment, because so many people have been let off their employment. But to say, we had this great big folder full of, 4 folders full of leaflets, and yeah, I think we must have given out one of those leaflets to somebody over the years. That's about mostly what I remember, and I just want to say thank you to the people that have been ahead of us, because from Sally Bigham, Brenda Woon was really a lovely lady, but even Angela Gill and Gold, we know we can approach them at any time for any questions, and we'd just like to say a big thank you to everyone for supporting us, because without you being there and being our rocks, sometimes it's been quite difficult. The matters we've had to deal with has been difficult. So just thank you to all, and we're just looking forward to being able to meet up for a coffee again like we used to.
Yeah, that would be really good.
So
thank you very much. Thank you, Jeanette. And it's been a pleasure for Angela Gold and myself to work with such a varied team, and as Nikki was referring to, with all of that wealth of knowledge. And we've also worked with someone that who I think is engaged with Caroline as well, called Gordon. And Gordon has amazingly designed some super systems that the surgery signposter volunteers are using and have always used, and indexing systems, and he is a genius. So he can't be with us today, but he will be watching on on catch up. So thank you very much indeed. So I'd now like to hand over to Zoe Huggins, the Mayor of Gosport, please.
Hi, morning everyone. Yeah, an unusual picture of me in Chambers, something where I've not gone often this year. Yeah, it's lovely to see you all. What I'm hoping to do is talk about the value of volunteers. So obviously surgery signposting is a volunteer delivered project. And we can add up the hours, and Nikki obviously put the hours down and the 800 people that you've helped. But I think it goes further than that. We cannot be binded by those numbers. The value of volunteering is far deeper than that, and far more fulfilling and important to contributing to the health, our unity, our social cohesion, and the vibrance of our community. We of course have seen 5 years of the value of volunteering with this project, and I'm pleased to see in some way that's going to continue. Through my career, I have worked with charities, I've worked with the most vulnerable, and I've actually volunteered myself. I undertook the Make Every Contact Count training, and recently, obviously during COVID, I signed up with GVA and acted as a volunteer. And I think, you know, we've heard so many stories of the real value and benefit, and they are a win-win situation for all. There's one individual that I remember quite early on where unfortunately his wife was taken into residential care due to Alzheimer's in the end of February. And of course, we then went into lockdown in March, and he suddenly found himself away from his wife, where he had never spent time away from. And being isolated and under lockdown was very, very lonely. And those minutes that we had that were extended sometimes longer, of conversation and connecting, and actually we underestimate that trust and the rapport that we build up very quickly with the service users that we come in contact with. And I learned so much about him in such a short amount of time. However, I want to flip that, and actually I gained an awful lot from it as a volunteer. It is fulfilling. It also supports my mental health and my connectivity out in the community. And actually you suddenly realise how closely connected we are. And you know, the true characteristics of a volunteer are about localism, are about being experts, are about being trustworthy, and having that passion and being able to connect with people, and wanting to listen, being that active listener. And that's really, really important that we understand the value on both sides. Nationally, we see the value of formal volunteering at approximately 24 billion. And if you're not aware, that's about 10% of our gross domestic product. So since 2014, we actually have seen that steadily rise, I'm pleased to say. From 2014, it was only 0.6% of our GDP, and now we see that around about 10%. And obviously with surgery signposting and social prescription, we've obviously seen that value and impact on the NHS, the supportive role that it has. We, of course, don't really know the impact of volunteers during this period of COVID. We can all hear the stories, but we're yet to measure the real impacts. And I think the impact of volunteers has definitely had a legacy during this period, and we've definitely really understood the importance and value of volunteering during COVID, all the way from the importance of this project all the way through some of the food banks and the prescription services that GVA have been supporting. And I really wish that, hope that continues to support the, unfortunately, most probably the long-lasting effects that we may see on COVID over the next couple of years. As I started, we can't just add up the hours, we can't just measure the monetary value. as a volunteer, it is the stuff that we can't measure so easily that truly are remarkable. The efforts and the time that as a volunteer we give to the community. And Gosport is lucky to have you all as volunteers and those that are employed by GVA. It is a remarkable community that I am pleased to be part of, but also representing today as Mayor of Gosport. So I want to personally thank you for your contributions. And on behalf of Gosport Borough, I also wish to thank you, and all have a wonderful Christmas.
Thank you very much, Zoe. That leads us really nicely into the next patch, which is where we take the risk. I come out of the PowerPoint and I hand over to Daniel, who's going to do a live stream for 4 minutes. So you just bear with us for a moment.
I think the most important thing was that there was no limitation on time. Okay, there's technically a limitation of 40 minutes, yeah, but it makes a huge difference if you don't have to be moving people on after 5 minutes or 10 minutes. Yeah. And people came into surgery, to signposting, and came with one issue, but it didn't take very long to realise that there were maybe 2 or 3 or 4 issues. There was one gentleman who I saw last year in his early 40s. He came in, he wanted some support for his wife who'd had a brain aneurysm that had popped, and he needed some rehabilitation information, etc. Fine, very happy with that. Then he said, oh, by the way, my son is on the autistic register, and can you suggest where we might be able to gain more support? Yeah. So fine, I thought, this is it, he's going to go. He said, oh, yeah, by the way, I've just been diagnosed with MS. So he went away, I can't say happy, but he went away contented, knowing that he had something to work with. And I think that's one of the key things about surgical signposting. The person comes in not knowing what can be done, and they go away thinking, well, yes, if I try this, and this, I can possibly solve it for myself.
They've got some options, and I know from our team meetings where surgery signposted volunteers are often saying that the patient goes in and they go, I don't know why the GP's referred me, or the nurse has referred me, or the pharmacist, I don't know why I'm here. And then your skill and the team's skill is teasing that out. That's right. That's really great.
The surgery signposting, knowing that you've been able to offer some help and that you've given people a degree of empowerment.
How did the service help? Because I understand you spoke to Sheila.
I spoke to Sheila, yeah. Well, we spoke to Sheila, didn't we?
So, if you tell me what happened when you spoke to Sheila.
Well, she was a great help to us and pointed us in various directions, not least of all Hampshire County Council and the volunteer, yourself particularly, as the coordinator, aren't you, of the signposter and age concern.
Gosport, that's right.
Gosport, yes.
Yes. And you came in, and our other volunteer from Age Concern Gosport, Elaine, she helped complete the attendance allowance.
Exactly, that was one of the recommendations. Yes,
yes, because that was to give you a little bit more money to help you stay independent within your own home. And that was a success, so we managed to get the forms completed, we got some more money, so that was great. And you contacted the Hampshire County Council Adult Services, and they put in, they gave you a shower chair, didn't they, which was to make life a lot easier.
That's all we required at that time. Yeah. It's given us some confidence at last that we're able to get help, not only for the medical but for other social events as well. You've been a great help.
Thank you. Yeah.
It's nice to know that you've got somebody you can contact who will listen to you, and as much as anything, you know.
It's would you say to anybody else or someone else who was in need of help, or maybe thinking about contacting surgery signposting at this time, what would you say about
definitely go for it. Your services must be underused. I think if people are aware of it, they would grasp it with both hands.
So, Ken and Betty, thank you very much. Is there anything else you'd like to add?
That was quick.
Is there anything else you'd like to add?
I don't think so, Angela. We shall contact you in the future, no doubt.
Yeah, of course, we'll always
yeah.
But we feel happier in ourselves now.
Thank you very much, Daniel. That was really heartwarming, isn't it? It's certainly, when I saw that being played, it's it really does show the difference that we're making, and hopefully in the future that we will continue to make, so in a slightly different way. Okay, so let's go back into. So thank you very much, Daniel. Sorry about the sound. We couldn't do a lot about that, but we thought it was worth playing because it's so much more powerful to hear people say that. So I'm now going to hand over to Angela Gold, who was in the interview, as you would have seen. So over to you, please, Angela.
Hello all, thanks ever so much for all coming. So really what I'm just going to talk about briefly is how Angela Gill, I joined in February 2018. I took over from the lovely Alison, and you know, we just wanted to have a look at the project and perhaps enhance what is already a fantastic service. And one of the things we noted was that there was a lot of no-shows. So why were people not turning up for appointments? Because it wasn't great for volunteers to be sitting waiting for patients to turn up. So we introduced a callback system. So I would get an idea of who had made an appointment via the Willow group, and I would then contact the patients and just talk to them, just to remind them that they had an appointment, but it also gave me the opportunity to discuss their needs. And that also helped in relaying that information to the volunteer. So I could then say, this appointment at X time, these are their needs. So the volunteer were also prepared to do a little bit of research and be prepared for that particular client and their needs. So that worked really well. And also I was able to measure whether they really did need to have an appointment, because some situations you know, wasn't required. They probably wanted a form filling in or something like that, which is not something that the volunteers would do on site. That would be somewhere where you would refer them to. But so that worked well, and it was trying to humanize people and make people feel less anxious about going. So that worked well, and it did reduce in the no-shows, or I think it was originally called DNAs, did not arrive. But as coming from a travel background, it was changed to no-shows. The other thing that we introduced was a telephone consultations. Not everybody could get to a surgery for the allocated time. So that was something that we promoted and introduced that. Obviously, Angela Gill, with her PR guru head on, as she is, we went full on with advertising, and we contacted local organisations and supermarkets, and we really hit everybody with posters and flyers and really get this service out there, because it's fantastic. So that was another thing we did. And I think the other important thing was obviously listening to the volunteers and what their needs were, because as discussed, there have been some really challenging cases that they've dealt with, and it can lead to be emotionally overloaded. And so we formed our group that we would able to call somebody to offload on that particular session. So it was peer support for being emotionally overloaded. And obviously the wonderful Gordon, who's already been discussed, and with help from feedback from the volunteers, we kind of created a better form to evaluate the data. So we were able to measure mental health, bereavement, isolation, all these different issues that you saw on the earlier graph that from Angela's executive report. We were able to measure and identify the needs, which certainly helps forward to future funding and recognising what the issues are within our community and able to support those within it better. So all in all, that's really, I don't know if Angela wants to add anything else, but that's really what we looked at and hope to improve the service. And I think we did, you know, the numbers were increased, a lot more complex cases came on board. And I suppose the other thing we did was operating from the surgery signposting office. I was able to, I took on cases as well over the phone, desperate people that wanted to speak to somebody there and then. I was able to do that through the surgery signposting office. So holistically, you know, the whole project came together and we worked really well as a team. And I'm very, very proud to have been a part of it. And again, the volunteers, they speak volumes to me, the expertise they have and the empathy and the skills, they are, you know, just fabulous.
Thank you very much. And yeah, just to reiterate what you're saying, really, I mean, attending the team meetings and listening to the transformational service that Surgery Signposter was the difference that it made to people's lives, and listening to the anonymous discussions about the individuals and how the volunteers move them forward from a very, very dark place, often very desperate people who couldn't find help. And by having somebody that would listen, actually take the time out of a day to listen for 40 minutes or so as needed, it's quite unusual in this day and age, because we're very busy people, aren't we? And we often don't have a lot of time to stay. We might say, how are you? But we've only got a few minutes and we want to be heading on to something else. So from my perspective, before I move on really to what's ahead of us, from my perspective, it's been a privilege. When Nikki brought me in, she said, not sure about the funding, Angela, I might just need you to keep this on track, from my colleague Sally Bigham, keep it on track for about 3 months, because then I think the funding might run out, and that was a few years ago. And in some ways that really says a lot about Nikki and her commitment to this project. And also more recently Ian Reeves, when they're looking at future funding and do we continue or do we fold. So that's a thank you really from me, a personal thank you from me to Nikki. But moving forward, and I think all projects move forward, this is where we're at. Thank you very much to Angela Gold and Daniel for the design of the interim service. GVA's new service is Community Compass, and the strap line that they all brought together was compassionate volunteers pointing you to the support services you need. That's what the new interim service is. And what it does is it builds on everything that we've learned from Surgery Signposters, but it brings it more into the community fold, still working really closely and in partnership with our primary care network colleagues, but also looking at the community's needs and running this initiative from GVA, from an office within GVA. So we're now operating, as I said, from GVA. We're working in partnership. We're using the expertise, which is so great. And as I say, it's such a humbling experience to be part of this project. It's providing essential support for local people, particularly during COVID-19. And Jeanette referred to the sort of pressures. And I know Angela, I speak to Angela every week, often talks to me about the calls, the need that there is still out there, even more, and the isolation and how people feel when they're actually scared to step outside their door, or they've lost a loved one during either for COVID, as a reason of COVID, or during the COVID period. Really devastating. And I suspect, which is why I'm really pleased we can run this service at least for the next few months, I suspect January, as it always is for us, January, February, March, really busy periods where people are desperately sad. They've had issues over Christmas. They've had a lot of sadness. And January, February, March seems to be, in my experience, one of our busiest periods. So I was really pleased when we were able to be underpinned, I suppose, funded by GVA to continue just for the next few months. We've designed, with Gordon's help, a simple online and secure referral form, which is available now from GVA's homepage. The project will support all people in need. So if you look at sort of the social prescribing in Gosport, this project has always been, historically, the Surgery Signposter Project always was the first tier. It was the place where people came before they were referred on to perhaps health connectors who had a particular health criteria, for example. So this service is available for everybody in need in Gosport. We're continuing the telephone consultations for now, simply because of COVID-19, but we will, when we can, potentially look at face-to-face again from Gosport Voluntary Action. Telephone referrals will continue via the GVA and Age Concern Gosport's triage number, and also through the website. As I said before, there's a referral form. The funding is interim. It's underwritten by GVA simply because at this point, thankfully, Nikki and Ian could not walk away from this project. So what we've devised with Gordon and with all of the team really is something that will plug a gap. My hope is that somebody will recognise that gap is going to be there beyond the 31st of March, but that's beyond my remit really. If they don't, then it will close on the 31st of March. So I feel really pleased as the project manager that we're not walking away at this particular time. And although I manage a lot of interim projects, leaving now would be problematic for me. So it's a positive end to Surgery Signposters insofar as we are continuing even for a short period. And I'd now like to say just a few thank yous from my perspective. You here today are here showing your support for this really important project. I want to obviously say thank you to all of the presenters who've put time and thought into their bite-sized presentations today. They've kept to time, which is brilliant, and I'm quite a stickler. I had my bell ready, but I didn't need it. So well done all the presenters, which was really good. Particularly big thanks to Daniel, and what you won't know is Daniel has been poorly all week, and he has come from his sick bed today to make sure that we could have this event smoothly run. So massive thank you for Daniel. I really appreciate that, because this is a two-person event today. So thank you very much for Daniel, even though you're poorly, for being here today. Thank you to the audience. And as Elizabeth and Nikki were saying, thank you to the Borough, to Hampshire, to the Clinical Commissioning Group for all of their support. And also to all the people that referred in. Some people self-refer, but a lot of our referrals were from GPs, because social prescribing saves GP time. And it also is a right fit. And my view is our level of social prescribing does fit within the wider picture within Gosport. So I do hope that there's some hope for the future. Again, a big thank you to Nikki, who after doing some handover, I believe in the new year, will be retiring. Many of you may know that, but she's been an absolute support for Angela Gold, myself, and for the team. Ian and Elizabeth and Nikki have all attended team meetings, so they know firsthand the sort of volunteers and the calibre of the team that we've got with us. And I'm so pleased we're taking those forward into the new year. So thank you very much, everybody. And I'm going to leave you, you're free to go, with a few photos, because as Angela said, I do say to people, if you go out there, please ask someone to take a photo. So here's a few happy photos of Elaine, for example, and Alex, who was in the earlier one. That was in, I think it was in Waterside. Me talking to some physiotherapists who were really engaged about surgery signposters, and we're referring people in from Gosport War Memorial Hospital. Towards the bottom right, there's me talking to Job Centre Plus colleagues who have been really supportive and send regular referrals over. And then top in the middle, there was an initiative at Bridgemere in one of the doctor's surgeries where they were doing an outreach and they wanted me to get up and be there. I think it was at 8 o'clock on a Saturday morning. And that was the lady there was the first lady to be helped. What they did is they were doing a clinic and then they were referring people on to me. So that was the first individual that we helped in that doctor's surgery. Then we've got Angela Gold and Brenda from Partners from Pain in one of the outreaches that we did for like an open day within the Willow group. And then top right is where I was presenting with my colleague Donna Simpson around social prescribing and talking about surgery signposters as part of what's called a target event, which is a clinical commissioning group event for not just doctors, but for all support staff, for primary care staff, care navigators, etc. So that's a sort of a legacy. And then the top left, by the way, was Elaine saying what it meant to be a volunteer, really. So those photos are really meaningful. We've got in the middle, we've got in the Discovery Centre where I used to manage, as probably some of you know, we did a pop-up during International Social Prescribing Day, and that was in March, just before we had the lockdown. So we've done what we can, really, and I want to say thank you very much to all of you, to wish you, as Caroline was saying, really, a very happy Christmas and also a healthy new year. And please do raise awareness of Community Compass. Do make sure that people know that the help is still out there, at least for a few months in the new year. Wishing you all a happy and healthy new year. Thank you very much, and you are all free to go. And thank you for all the kind comments in chat. It's been really nice to read. Thank you, folks, and goodbye.